Welcome to Health Talks. I'm Gail Hogan, and today we're discussing depression, a very common mental health issue with sometimes surprising symptoms. Dr. J. Fournier joins us to explain what depression can look like for many people and what the experts at Ohio State can do to help. Dr. Fournier, thank you for being here.
My pleasure.
Let's start off with that description or definition of depression.
Yeah, so depression is a common medical illness. It's a serious medical illness, and it's a treatable medical illness. So the sort of most notable symptoms of depression are, of course, sadness, loss of interest and pleasure in things that you typically would enjoy. We often see appetite changes and weight changes, sleep disturbances. So that can either be having difficulty falling asleep or staying asleep, or sleeping too much. Difficulties thinking and concentrating, excessive guilt or feelings of worthlessness, and then thoughts of death or suicide. So in depression, we often see those symptoms persisting for several weeks, if not longer, and really interfering with daily functioning.
You said it was a medical issue, and when I introduced you, I said a mental health issue.
Yeah.
And I think that's one of the things that you, as a doctor, are trying to get culture and the population to understand.
That's right. That's right.
Why is that?
Yeah. I mean, so we think of depression as, in some ways it's both, but depression is a disorder of the brain, right? So the brain is our largest, sort of most complicated organ. And like any other organs in our body, sometimes it doesn't function as well as we would like it to. And when that happens, people have symptoms. Depression is one of those illnesses that can happen due to the brain not functioning as well as we would like it to, and we have treatments for it. And so, I think part of it is getting folks to understand that it is a serious condition, a treatable condition, and also a medical condition, that it's not their fault if they become depressed, that this is, again, with any of our organ systems, things can sometimes not go the way that they were supposed to go. That's true in our most complex organ.
Are there different types of depression?
There are. So it's an important question, and it's actually an area of active research here and at other institutions. So we know that there are certain different types of depression. What we've been talking about is typically called major depressive disorder, or people sometimes call it clinical depression. There's also something called bipolar depression, so that happens in the context of bipolar illness or bipolar disorder. And so that typically happens in a chronic cyclical fashion where people experience episodes of depression followed by episodes of mania or hypomania. It's important to differentiate that because the treatments are somewhat different. There's also a different type of depression called seasonal affective disorder, and that's where somebody's experience of depression can fluctuate with the changing of the seasons. Most often we see that in the winter months, but it doesn't have to be that way. There are some people where it's the opposite, where they are more prone to depression in the spring and summertime. And again, it's important to differentiate it because the treatments can look a little bit different.
You mentioned in symptoms that they can last for weeks, maybe months. So is that the difference between somebody feeling a little blue, under the weather, maybe even, in the wintertime, they just don't feel as they usually do? What's the difference?
Yeah, I think that's part of it. So we look at, I guess, at two things. So one is the duration of the symptoms, and the other is the intensity of the symptoms. So if we were to diagnose major depressive disorder, for example, well, people sometimes call that clinical depression. So we would look for the symptoms to last for at least 2 weeks. But also we look for the symptoms to be there most of the day, nearly every day for those 2 weeks. So they're intense, they tend to be unrelenting. Another key difference is that they interfere with functioning in some important way in the person's life. So interfering with school or work or relationships. I think another key difference is that often with the full clinical presentation of depression, not always, but oftentimes we see people experiencing some symptoms around suicide. So they might have some thoughts that life is not worth living, they'd be better off, everybody would be better off if they weren't around. We typically don't see those in just, when somebody's having a bad day, for example. What
are depression symptoms in teens?
So by and large, the symptoms can look pretty similar in the teenage years, but there are some differences that I think are important to know about. So particularly among teenagers, we often see increased anger, irritability, increased frustration. You can also see increased sort of sensitivity to rejection, to being left out, increased sensitivity to failure. We might see increased sensitivity to social things that are happening in their lives. We might see increased social isolation. I'll say, particularly in the teenage years, I think it can be challenging to differentiate, particularly for a layperson, what a teenager might be experiencing from the typical ups and downs that we expect during adolescence. It's a hard time of life, right? So I think if anybody has concerns, to reach out to a medical or mental health provider, to get checked out. We can provide assessments to help determine if this is something that we might think is typical for an adolescent experience, or if there's something else that's going on that we can provide some help for.
What's the difference between depression and anxiety?
Yeah. So I think, we're all familiar with the feeling of anxiety, right? It's that uncomfortable sense of kind of tension or fear or apprehension or worry. It's a natural emotion that we all have. I think when anxiety becomes persistent and intense, again, when it starts to interfere with functioning, that's when we start thinking about an anxiety disorder. It's often hard, I think, for people to know whether what they're experiencing is depression or anxiety. Mm-hmm. And it turns out there's good reason for that. So we often see them coming together.
That was my next question. Yeah, do they intersect?
They do. And estimates there differ, but it can be as much as 70% of the time that they would happen at the same time. Somebody would experience both depression and anxiety. I think it's really important when that happens for somebody to get a really thorough assessment. And the reason is that both depression and anxiety are treatable, but the treatments are different. And so we need to make sure we understand what's going on so that we can give either the right treatment or the right combination of treatments to get the person well.
Let's talk about treatment first for depression.
Sure.
Medical, talk therapy, or psychology type therapies.
Yep.
What?
Yeah. So the good news is that we have a whole variety of treatments for depression across all levels of severity. And that's important because it allows us to personalize a treatment package and a set of treatment recommendations for a person. Part of that package can involve medications. So we have a number of different kinds or classes of medications to treat depression. We also have a number of different kinds of short-term, brief-focused psychotherapies that have been proven to be at least as effective as the medications in the short term. And there's some indication that they're actually even more effective in the long term at keeping depressed patients well. Now, it's just true, some patients need a medication. Some patients need the tools that they're going to learn in psychotherapy. And that's part of the reason that we want to do a comprehensive assessment, so that we can try to figure out what treatment strategy is going to sort of be the most likely to get the person well in the shortest amount of time.
You're an expert in dealing with people who just can't seem to get over that depression hump.
Yeah. Resistance
to any kind of treatment that you've just described.
Right.
How do you help those people?
Yeah, so right, we have a phenomenon. It goes by a couple different names, either treatment-resistant depression. I prefer difficult-to-treat depression, where it's situations where our first-line treatments, either medications or psychotherapies, just aren't working as well as anybody had hoped for a particular person. Again, the good news is we have a variety of other options. So there are now newer fast-acting medications, so ketamine and esketamine are examples of that that we do offer here at Ohio State. There's also a treatment called transcranial magnetic stimulation, which allows us to alter the functioning of a particular brain circuit. As an outpatient procedure, it's perfectly safe. We can do that. We use a magnetic device in order to do that. And so that's one option, works in a completely different mechanism than all of the other treatments we've been talking about. We also have newer brief psychotherapies that really focus on functional recovery, or getting a person back engaged in their life to pursue their goals in a way that feels meaningful to them. So that would sort of be the next tier of treatments. And sometimes those treatments don't work as well as we would like either. We have yet a third tier of treatments that are more invasive, but they do tend to be quite effective. So that includes things like electroconvulsive therapy, vagal nerve stimulation, and deep brain stimulation. So deep brain stimulation involves implanting a device in the brain. It's fairly similar to a pacemaker for the brain, where we can provide more constant stimulation to a particular region of the brain to help the person get better.
Is it possible that someone can have depression for years and years, but it's treated so they can function? They never really get over depression. Does that happen?
Yeah, I think it, I guess I have a couple thoughts there. I mean, some people can get somewhat better, but not all the way better, right? And so I think if folks are in treatment and still experiencing some symptoms that they find problematic, I would strongly encourage them to talk to their provider, because again, we have a variety of approaches. You're not stuck with just one treatment. And if your goals aren't being met, we have other options to try to help you. That said, I think there are some people who are probably going to experience some fluctuation of symptoms over the course of their lives. The perspective that we take here at Ohio State is really trying to help people get back engaged and functioning in their lives and having the kind of life that they want, and minimizing the impact of any residual symptoms they might experience.
You've mentioned personalized treatment, very important in this regard.
Yeah, absolutely. I mean, we have at least 4 or 5 different classes of treatments, and what I mean by classes of treatments is treatments that work on completely different brain mechanisms. We know that not every patient, I wish it were so, that we had a treatment that worked for everybody. We just know the research tells us that's not true. And what that means is we need to figure out what treatment is going to work for the patient who comes to see us. And so when people come to see us, we do a comprehensive assessment to try to use our knowledge to make personalized treatment recommendations about what we think is going to be the most likely effective strategy for them at this point in their lives.
Does age have anything to do with it? Sex, man, woman, what about teenagers as opposed to adults? Do any of those things jump out at you as one of the reasons that may cause depression in some and not others?
Yeah, I think there's a number of considerations across each of those groups you mentioned. So starting with gender, we use the same criteria to diagnose depression in men and women, but there are some differences. So women are about twice as likely to experience depression as men. That is something that we see globally. There are a couple of explanations as to why that might be the case, but women are at higher risk for depression than men. The symptoms look fairly similar, although there's some indication that in men, depression can manifest with more anger and irritability. We're more likely to see that anyway in men than in women. Women are more likely to ask for help, and men are about 3 to 4 times more likely to die by suicide. So there are some notable differences, although we think about the illness as being fairly similar between the two. In terms of age, I think there's a couple considerations there. So actually, the highest prevalence rate for depression is in young adults, so 18 to 25.
And that's going up?
Yeah, and it is going up, actually. And I think the pandemic probably did not help those numbers. After sort of young adulthood, the prevalence rates do steadily decline over age, but there are really important considerations as folks get older. So in our older populations, depression can actually be difficult to diagnose. It's often mistaken by the person and sometimes by their medical providers as maybe difficulty adjusting to life circumstances having to do with aging, or difficulties related to a medical illness or adjusting to a medical illness. It's important to note depression is not a part of healthy aging, and we can treat depression across the lifespan.
You keep bringing that up as to people reaching out for treatment.
Yeah.
Is that part of depression that people are reluctant to reach out for treatment?
It can be. I mean, if you think about depression, one of the things that it does is it gets people thinking fairly negative thoughts about themselves, right? So excessive guilt and worthlessness is a symptom of depression, right? And so given the stigma that I think that sadly already exists around mental health, I think for a number of folks, they can find that, or they can come to think that it's somehow their fault that they're experiencing this illness, or maybe even some hopelessness that there's nothing they can do about it. And so I do think all of those factors contribute to making it hard for some people to reach out for help.
And when should they? What are some signs that if someone is watching this right now, they wonder, is it time for me to talk to someone like Dr. Fournier?
Sure. I think there's a couple considerations. So if you're experiencing symptoms that aren't going away, that they've been around for a couple of weeks, I think that's a good time to reach out and talk to somebody. If you are really starting to notice that the symptoms you're experiencing are interfering with your life, if they're interfering with your ability to do your work or go to school or in your relationships or friendships, I think that's a time to talk to somebody. Or if you're starting to have thoughts that life is not worth living, things would be better if you weren't around, or even thoughts of hurting or killing yourself, that's definitely a time to reach out and get some help.
How can the experts at Ohio State help folks?
Yeah, so I do think we have a lot to offer here at The Ohio State University. We have experts, world-renowned experts, both researchers and clinicians. We're coming together to do a couple things. First, to make sure that we're providing the most effective and cutting-edge treatments for depression. We're also actively working to innovate in this space and develop newer and more effective treatment strategies. There's a couple of other things that I think helps us to stand out. First is that personalized treatment approach. We know that not everybody is going to respond to the same kind of treatment. So we start with that comprehensive assessment, and we really do want to make sure that we're recommending a package that is most likely to work for a particular person. And part of that means that we have a variety of treatments that we offer here at OSU. I think the last thing that I want to say about that is we set our bar pretty high for depression treatment here. So yes, of course, we want to try to help somebody get well as quickly as we can, but we're also strongly focused on making sure that they stay well longer term. And so we have a couple of treatments that we offer really to try to make sure that they're able to maintain their gains and stay well in the long term.
And will you help all ages at Ohio State, or is it only adults here?
Yeah, it's a good question. We do have partners over at Nationwide Children's Hospital who have real expertise in mental health concerns in children and adolescents, and so I'd say we work really closely with them to make sure that we're between the two of us, we're able to provide whoever comes to see us with the best care that we can provide them.
You mentioned innovation, so that means there is innovation and research going on right here at Ohio State. Can you tell me about that?
Yeah, there's research in a number of areas. I think that the common thread across those areas in depression research here is we're trying to use what we understand about brain function to do a better job at characterizing individuals with depression, developing more effective, longer lasting, and more personalized treatment approaches. And so one example of that from my lab, we're using a technique called functional neuroimaging to try to get a sense of how depressed patients' brains are functioning in real time to see if we can use that information to guide which treatments we might recommend to them. The other I think important consequence of that kind of work is it helps us determine if there are certain patients that we need better treatments for. So that kind of research will help us understand what might be going on in those patients' brains that we may need to develop a new treatment to target.
Dr. Fournier, this is a very important conversation, and I'm glad we had it. Thank you so much for joining me.
Thank you. Appreciate it.
And thank you for joining us for Health Talks.